Have you witnessed any clinical cases of the use of your products in Alzheimer's patients?
Absolutely.
Yeah.
We've done in a subset of patients, I think 10 or 12 patients a couple of years ago, we took what's called mild cognitive impairment. Brain fog, lack of memory recall, and we give them a cognitive exam and we take pictures of the brain through functional MRI and we show that there's reduced blood flow to the prefrontal cortex. They do very poorly on cognitive exams or memory recall. And then we treat them with our nitric oxide releasing lozenge for 30 days, bring them back. Blood flow is improved in the brain. They improve on their cognition. And the improvement in cognition correlates very nicely with an increase in blood flow. So, and that's now we're developing that into an FDA clinical trial with the help of Dr. David Perlmutter that will enter this and get this through a clinical trial and hopefully have an FDA-approved drug for Alzheimer's in the coming years. But that takes time and money, and we're in the process of allocating the resources to do that, design the drug trial. But for me, it's about enrolling the right patient, right? Because the success or failure of any drug therapy is number one, the clinical trial design and the dosing regimen. So I want to catch patients far enough along, vascular dementia, early Alzheimer's, where we can show that we can, at least slow the progression, but also get them far enough along to where we can show that we can regress the disease. They actually get better. And so selecting that patient cohort is going to be very important. And the success or failure, I think, of our drug trial is going to be on the patient inclusion in that. But, the basic science data is very clear. The clinical translation of it is very clear. And, now my job is to get this in the hands of many clinics, Alzheimer's clinics, and start treating patients in a double-blind, placebo-controlled study and get this drug approved and on the market.
Yeah. And I'm thinking, about the synergies of this. Of course, when you're running these clinicals, you want to isolate, nitric oxide. How is that improving it? But I'm also wondering if you have heard of other doctors. Even when I had Dr. Besner on from Therasage, he was saying, take the NO, right, the supplement before you jump in the infrared sauna or before you do any ozone or anything like that, improve the absorption of it, which was very interesting. And then you think about hyperbaric chambers or just pure ozone therapy, all types of different ones. And that idea of synergistically using an NO supplement to boost while doing that to enhance the actual results. Have you spoken to doctors or seen that yourself where there are synergies with other therapies?
No, for sure. I mean, nitric oxide is foundational. It's not an end-all, be-all, cure-all. It's not a panacea. There are other things we have to address. And then, unfortunately, in drug trials, we have to isolate a single drug on top of whatever else they're taking, right? So we can't withhold treatment. We've got to add this on top of whatever they're taking. But look, in the field of biohacking, we're seeing this potentiation of the therapeutic effects of infrared sauna, of hyperbaric oxygen, of all these other what we call biostacking, because nitric oxide is going to dilate the blood vessels, improve tissue oxygenation. The mechanism of action of red light therapy is releasing nitric oxide from metals and activating mitochondrial energy production. And so if you got a patient that's nitric oxide deficient, they have less photolabile stores of nitric oxide to be released by infrared light. And so if you take the lozenge before infrared, which is what I do every morning, take my lozenge or my beads and I get in my Therasage 170 degrees for 30 minutes and detoxing. I'm fully oxygenating my blood, and it's that time I do my prayers and meditation and express gratitude, and that's how I start my day every day, and it's a great way to start the day.
It really is. I have to say that's one of my favorite things, is to jump in there, take a little NO before and kind of just start it off on a good foot, right? On a good basis. But for others listening to this that may say, okay, I'm thinking about trying something, a supplement of yours or anything, any counterindication, adverse reactions that you should know about when you're dealing with nitric oxide?
Yeah, I mean, nitric dose dictates poison. So too much causes what's called methemoglobinemia, and it can cause an unsafe drop in blood pressure. But the doses that we're delivering in our consumer products or over-the-counter products, we've never seen an adverse event. We've never seen any methemoglobin formation. We've never seen an unsafe drop in blood pressure, because we know kind of what the toxicity load of nitric oxide is, and we would never deliver that. For supplements, all you have to do is demonstrate safety. We can't demonstrate efficacy. But in our drug trials, we'll titrate up the dose and look at not only the safety, but the efficacy in these different indications. But so some of the common feedback is people develop like a mouth sensitivity and their tongue gets sore, like a burning sensation. And it's not that common, but it's not uncommon. And what we're finding is that it's diagnostic for a really low pH of the saliva. So if your saliva is really acidic, that lozenge can cause some irritation. So the solution to that is a couple of things. Number one, you can take baking soda, swish it, raise the pH of your saliva, and then you mitigate the sensitivity of the lozenge. But more importantly, you got to figure out, why is your saliva pH so low? Are you mouth breathing it at night? Are you using fluoride in your toothpaste? Are you using antiseptic mouthwash? And so we try to get people to focus on restoring their oral flora and going to a good biological dentist who understands this, and not some regular dentist who's going to fluorinate you and tell you to take chlorhexidine and mouthwash and all that and make things worse. So focusing on the oral microbiome is kind of front and center for us. And the people who do develop the sensitivity, it's diagnostic for oral dysbiosis. And so, I encourage people to switch to our CardioSmile toothpaste, stop using mouthwash, change the ecology in the mouth so that the good bacteria can repopulate. We can normalize the salivary pH, and then the sensitivity goes away.